right. Well, back at it again and checking up on some more updates on the coronavirus or the COVID 19, as it's now sounding. They now named it. So, I guess I'm gonna go into the World Health Organization briefing today. This was earlier. I picked out some key points. Um, they ramble a lot because they still don't know very much about this, and the questions people are asking, well, they don't really have a whole lot of answers for, and it's concerning. It is, and all we can do is rely on these guys, because they're kind of like our front line. But there's been a lot of speculation coming out lately that even CNN has reported on. Coronavirus crisis is raising questions over China's relationship with the World Health Organization, because people think that China's got a lot of sway. They're a big donor to the World Health Organization, right? And money, unfortunately, does talk, and we're only going on what the numbers China's given us. And they're like, oh, no, don't worry, it's all good. But we're starting to see a pattern on the cruise ship. The numbers on the cruise ship are 1/3 infected so far. Out of 720 tests, there's 200 and some odd. So it's basically like a third, right? And it could be more, because it's very hard to test for this. And also, there was faulty tests that were sent out. I'm not sure if it has a factor over there or wherever, but I'm sure it did play a big role in the whole scheme of things, because they sent out these tests, and there was basically, it's like a liquid agent that they use during the test, and yeah, it helps it helps them detect the virus. But I guess it's just this liquid agent, so they got to remake this stuff, and that doesn't take that takes time, and time is what we don't have right now, and countries relying on this stuff. It's a lot, right? There's wow, it's a lot. In my opinion, there's a lot of mistakes being made. Um, it's easy to look at them and criticize them after they've been made. From their logistical standpoint, like the World Health Organization, they're just they're just like an advisory committee. They can't make rules. They can't say you got to do this. They can only suggest things. They have no power whatsoever to tell people what to do. They can only suggest and offer them support on choices that they're gonna make. All right, so they're not shot callers in a sense. CDC is a little different, because they're they can have they're more of a government, and they can get military action. So can the World Health Organization, but they wouldn't order military action. They could suggest it, but they couldn't order it. So anyways, we're gonna go right into this, and this here, a big shout out really to the frontline workers, the people at the hospitals. Like, holy shit, man, like those people don't get paid very much money, and they get lousy shifts. It's rough work to begin with, and now there's a lot of people being exposed to this, not just China, but all over the world, right? And these people can't be thanked enough, really, because without them, we'd have no defense at all. We wouldn't. There'd be no way we could contain it. So let's hope the front line, is solid, and it is as solid as it can be, um, in the West and onwards. But in China, it's being tested to the max. Um, Unfortunately, there's I guess 1,716 health workers infected, and 6 have died so far. That's numbers China is saying. That's not and take that with a grain of salt, because there could be a lot more, because we don't know how viral this is. We don't know how, um, you know, they, I have an idea, just considering that it's patterns, the way that it's spreading in other places, um, is showing that this thing is highly, highly contagious for sure. So, anyways, big shout out to the frontline workers for sure. Uh, can't say enough. Can't say enough. Really can't.
Yes, hello, Gunilla von Hall, Swedish, Svenska Dagbladet. I have a question on the medical workers, 1,716. Do you consider this figure credible? Are you worried it's actually more? And how worried does it make you feel, especially now when you have more people coming to hospital as they have enlarged the definition? And if I may add to that, the ones who get ill, infected, and then recover, do they have immunity for life?
I'll start on this question, but I will hand over to Sylvie, who has maybe some important messages to health workers around the world on the implications of these data. The fact that there are over 1,700 cases amongst all of the cases of COVID is very sad news. But we've seen this before with MERS. We've seen this before in SARS. We've certainly seen it with hemorrhagic fevers.
That's downplaying right there. All right, when he's saying we've seen this before in other outbreaks and da 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 da. Yes, we have. Yes, we have. That's right, but not to this extent. Not to this extent. Really. There's so many holes. But anyway, they are doing a hell of a job trying to keep this under wraps. And I really do believe that this isn't something that came out of nature. And I hope I'm wrong. It's not a conspiracy theory, and it's not, spreading false news. It's nothing like that. It's a thought. And it's a goddamn scientifically backed thought at this point, considering, the behavior of this and just the secrecy surrounding it and the lack of it really is something that's at the highest levels, and they're trying to contain this, but they can't. It's spilling over now. Whether the truth ever comes out, who knows? Maybe it's not. Maybe it's not. Maybe it just is some vicious form of evolutionary freaking nature, because it's not something that just follows the progressive path, along the lines of evolution. Things progress at a different stage. Even viruses, they don't make huge jumps, in evolution, or it doesn't really happen. And there's a lot of scientific data supporting this, but it's not really being broadcast. Everybody's just looking at the World Health Organization saying, hey, and they still say we don't know nothing. But it's hard to believe that now, because they've had this going now for 2 months, and they've had the best people in the world on it right from day one, you can guarantee. So do they know something and they're just not saying it? Because if they say it, would it create mass pandemonium, like mass hysteria? Everybody would kind of lose it. to say the least. Um, so you gotta really take into consideration, and a lot of people don't really acknowledge the fact that this is bigger than what it looks like. And if you dig a little deeper, you'll see it is bigger than you could imagine. Um, the cruise ship is giving us the only vital or the only real numbers outside of China. That's the only place. Everything outside China is kind of small. It's just little tiny outbreaks. It hasn't really got a foothold yet. You don't see the impacts of it. Because it's just kind of still secretly spreading around. It's very silent. You don't show symptoms from this from up to like 14 days at least, and they're saying now it could be up to 24 days. And that was a scientist who did this report say, like, they did this study and they said, well, and it was out of Shanghai, China, I think. Anyways, regardless, it's very contagious, and we don't know nothing about it. And you have to really kind of take a step back and say, or at least I am. I have. I knew right from day one there was something going on. As soon as they locked that first city down of 11 million people, right then I was like, what the hell? I was totally blown away at that moment. But then after it started rolling out, city after city after city, and the lengths they were going to quarantine this thing, it's unprecedented beyond anything of any action of ever taken. And this is by the Chinese government, right? You got to think their financial markets are just destroyed. They are. And there's nothing they can do. Everybody's pulling out. All the big tech companies. There was it's crazy how many companies are shutting down, and like big meetings. Facebook was the most recent one to cancel in San Diego, California. They canceled. Or is it San Francisco or San Diego? I think it was San Diego. There was a 5,000 group meeting in California, and they canceled it because of the coronavirus. It's not what you think. It really isn't. And they're not going to tell us, I don't think. They're kind of hoping that they can fire off a vaccine quicker than it can take out a certain amount of people. It's like a collateral damage for them. They know that every moment that's passing by is costing time, but they're trying to keep the markets running. Their biggest thing right now is trade and markets. If that goes down, well then, they can't let that stop. So that's why they're, it's a catch-22 situation. They're taking the public health risk at the moment based on the numbers out of China, which are wrong. And they're making these models and saying, well, we still got time. We still got time. But China's so full of shit. They really are. And I think these guys know it. Like, they would know. Do you know what I mean? They've had boots on the ground there. They'd see, or maybe they wouldn't. Maybe China did such a goddamn good job of cleaning up before they came in that it just, kind of just looks like, they kind of got it under control, but it's still spreading. I don't know. Am I being too skeptical about it? But there was a lot of videos, and a lot of them like really logistic or genuine, I guess, really genuine, and even some of them being broadcast on mainstream media. So, and that was like on the 20th and the 22nd, the 23rd, when all these videos started rolling out, because that's when shit hit the fan. Literally, like, it was around the 20th of January when shit started breaking down. Like they tried to cover it up, but they couldn't. And the Chinese government was just telling people, go to the hospital if you need to if you're sick. It's all good. Don't worry, you'll get cared for. And this is what they told their citizens. Like, yes, you will go there and we will help you. Don't worry. Continue on. This isn't anything. And then they go to the hospitals, but the hospitals just got overcrowded. Everything. They ran out of supplies. They ran out of doctors got infected. Nurses got infected. Other patients in the hospital that didn't have it got infected. It went through the whole hospital. There's a few hospitals now this thing has just wreaked havoc on. And I got a report on that. And we'll get into a little after. Because we have no idea how vicious this is. Really, we don't. They still have no answers. Except that, well, it's airborne, but it's not airborne, it's aerosol. That's what they said. And they said within 6 feet. That's a single person within 6 feet. But what if you had 3 or 4 infected people? Or 20 infected people on a plane? 6 feet becomes 60 feet. It's not, it's crazy. It's so sloppy. It really is. And it's not that I don't think I could do a better job at it, but I think what they're trying to do is cover up, or not really trying to cover it up, but, they're basically taking China's word for these numbers. And they must be under a lot of influence, like political influence, really. To keep trade going, to keep the markets going, like the big billionaires, like these guys got swing, right? And don't think they're not buddy with like some pretty high up people, right? And they all talk. They're just like humans. They're like everybody else, right? It's like, well, we can push this off for a little bit, and just see what we get for numbers this time, or like, you know what I mean? Just and da 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 da. And that's what they're keeping on doing, just kind of pushing it off a little bit longer, And all the while, this thing is just setting its foundation all over the globe. And we still have no vaccine for it. There is something extremely worrying that I picked up on. And it's about these lab tests that they're being sent away. Anyways, they're showing negatives, right? It's showing negative for the virus, but the virus is still in there. And I'll get into that later. And it comes right directly from health minister. So they said when they're sending the vials away, yes, there's still fragments of the virus. So, and it's testing negative. We're relying on our testing methods to catch this, right? What if the methods are wrong? This is something that we've never encountered before. It's a new virus. Yes, I know scientists are smart, but we're only limited, or we're only as smart as our technology. We're limited by our technology, and if this thing has evolved somehow, that it's getting around the technology that we currently have, I don't know, but we'll get into that. It's interesting stuff, and I kind of spieled off there for a while. But yeah, they went in, there's 1,600 health workers who got, 1,700 I guess they're saying now, excuse me, but that's what China's saying is officially 1,706 died. Well, I don't believe I'd like to think that they're being truthful about that, but 1,700 maybe in Hubei alone, maybe in just that province, I could maybe believe there, but not nationally. I don't think, because you have everywhere. It's like the hospitals are all just jammed, and they're out of proper personal protective equipment. They really are. There's huge shortages, massive shortages, and they can't keep up with the demand. It's crazy, right? So the health workers are being exposed, and these people are going into the hospitals, and there's only so many quarantine units in the hospital, right? They can't just put them in a regular room. But while they're in the hospital, they're in the waiting room, right? So, or they're being transferred from somewheres to somewheres. Like they're going through a population in the hospital that thing could, infect, and it has infected a few hospitals. Um, Gone right through. Yeah, just let me see. Where's the next one? Um, so yeah, they were talking about immunity, about the people who get healed, and then they have like if they have immunity to it, because people are saying that they're getting healed, but they're not sure that they're actually healed. It's anyway. If we'll go in, let's just check it out.
Thank you, Mike. And indeed, so we had this data, and now we are really discussing with Chinese authorities to understand what has happened. Although it's not unexpected or unusual, because we have seen this in previous outbreaks, but it's very important to understand if it has happened in the emergency ward, or if it has happened when they were treating patients, or somewhere else within the hospital facilities, so that we can also target implementation of corrective measures. What also is very common in epidemics, especially when people are working 24/7 and they are under a lot of pressure, is the fatigue of the staff, and probably the peak coincides with the time where people were already exhausted, and maybe they have not been as attentive as they should have been on infection prevention and control measures because they were too tired. But we have learned that Chinese authorities have sent a number of other doctors from other provinces to continue to support hospitals in Wuhan and help the health workforce. But we know that, as Mike said, is that health workers are always at the front line. They are the first one to see the index case, the patient, and so they need to get prepared. So we have first developed a training package for them, and you will find it on Open WHO, our massive online open course platform. And we are also having dialogues with more than 40 international medical and nursing associations to make sure that the advice and recommendation reach most of the healthcare workers. And so we are. It's a process, ongoing process, and we have a teleconference next week to discuss with those people.
And immunity when you recover. Sorry.
Yeah.
Yeah, this is about like the immunity. But basically that whole spiel was blah blah blah. We put up a safety advisory thing on an online thing that trains people, which is it's just important, of course, but they're healthcare workers. They it's a little, they understand the gravity of it, but it's being very very I guess infectious is the word, because it's so stealthy. But anyways, they don't have any answers really. But anyways, this here's a follow-up question. Reporter asked about when people get healed, are they immune to it? Can they get it again, kind of thing. So anyways, and well, long story short, they don't have an answer for that either.
Yeah, we don't. Obviously, it's too early to tell what the immunity profile will be. We really don't. We don't have a serology test even to test for immunoglobulin response yet. So it's going to take time, and it's impossible to know. But we would expect that recovered patients.
So what he said there, a globulin response test. Well, globulins, think of them as like they're the things that are going to fight off the virus. The globulins come out, they're activated by your immune system, right? But they don't have a way to test this, right? Is what he's saying. They don't even have. They just admitted that they don't have a test to see if this is, how it's attacking or how your immune system is responding to it, I should say, which is kind of scary. They can only test for this, I guess. They still have like no idea like what's actually going on inside the body. Like it's very elusive to them. All right, and it's so anyway. We'll continue on.
Would be protected from having another infection, but for how long that protection lasts, or whether that protection covers other coronaviruses, is impossible to say at this point. That's an item for immediate research.
Yeah.
It's an item for immediate research. Yes, they it's terrible. It really is, because this thing is getting stronger, and they still have no idea. They have no answers, really, or if they do, they're not saying. It's one or the other, right? Let's hope, that they're not bullshitting us, right? Because these are frontline people, and they are kind of influenced by political sway. Of course they are. Even the scientists giving them the data, the scientists can be swayed to, kind of make it look not so bad. It's all on different levels. Like these numbers and these reports and these models that they're basing all their actions on are unfortunately flawed. And that's just the way it is. And we don't know to what degree, they are flawed, but it's off, right? It is. And yeah, they go into the Olympics. And here, this kind of gives you an idea of what the World Health Organization does, because he explains it pretty clearly.
All the easy questions, Jamie. Already said that's an item for immediate research. Yeah. But again, important to recognize when we say recover patients, and when patients are discharged from hospital, they're swabbed before discharge. Many are tested negative, and it's really important that we don't start creating stigma around discharge.
And what he said there again, they're swabbed before discharge, and some of them have tested negative. Okay, but what's more key in that whole statement is that they did a swab. Just an oral or a nasal swab, which can be detected if you're infectious. This thing has, I'll go into it after about how it goes infectious, and then it's not infectious, and then you are infectious. Anyway, I'm sure they know this too, right? But so they're doing the swabs. They're not doing a test. It's a blood test, or they're doing swabs. And as long as you're not being infectious at that moment, you can go. But then people are getting sick again. There's tons of cases on it. I'll show you.
When patients are discharged from hospital, they are considered to be fully recovered, and as should be welcomed back into their communities with open arms. They're survivors, and they should be seen and welcomed and celebrated as such.
Thank you very much. Dr. Tedros has left his office in Kinshasa, so we will continue with our speakers here. Jamie, and then we will go to journalists online.
Can you hear me? Can you hear the microphone? Yes. Okay. Hi, Jamie, Associated Press. I'm sorry, I just wanted to follow up really quickly on Christiana's question about the Olympics, because that is a major concern. And the Tokyo authorities said apparently that you guys had told them that there's no reason to call it off, but there's a lot of people in China that are afraid that they may not be able to fully participate. But that's not my actual question. My question is, could you please respond to what was said by Lawrence Kudlow about China. As much as you said many nice things about how China is responding, there was criticism from Larry Kudlow at the White House saying that China is not being transparent and they're disappointed that the United States has not been invited in. So what do you say to that? Thank you.
All the easy questions, Jimmy. We have not offered advice to the IOC for the Olympics one way or the other, and neither would we. It is not the role of WHO to call off or not call off any event. It is the role of WHO to offer technical advice, to support a considered multi-layered risk assessment around the event, to offer advice on risk reduction and risk mitigation measures, to offer advice on risk response measures, and it is the decision of hosting countries and the organising agencies to make that decision. So let me be clear, and we are continuing to do that. Will continue to do so for each and every event that is of interest. We are a member state organisation. We are there to support our member states and support our partners at large internationally in that endeavour. So I don't know Mr. Kudlow, but the question is about access for response within China.
Transparent.
Yeah. Well, transparency about access with the team, Jamie, or transparency
well,
with...
I mean, but he's criticizing, he's disappointed that there's not transparency and that they haven't been invited in.
Mm-hmm. Well, it's opinions and speculation. We've been very clear on the fact that we've had a team on the ground, as our WHO office has been there since the very beginning. Our country representative and a team were in Wuhan weeks and weeks and weeks ago. So from our perspective, we have a government that's cooperating with us, that's inviting in international experts, that has shared sequences with the world, that continues to engage with the outside community, that has published again and again.
But anyway, blah, 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 right? So he didn't have an answer. And they don't have answers. That's in any answers that they do have, it's just very minimal, or we need to do some more research on that, or let's go in and read this, or actually I think there might be one more thing in here. Yeah, nothing really. Yeah, nothing really of interest. It just goes in about the ships, that there was a few of them that were having problems docking and they wouldn't let them come in these places, and he was, saying that people should allow them to dock, but it's, it's more or less up to the country if they're going to allow that. So, they can't force a country to say, hey, let these guys dock. They don't do that. And as he said, they only give technical advice, right? They can only give technical advice, and the actions come based on what the country wants to do, right? But these guys here are telling us a lot, especially when they say they don't know about it or know nothing about it. And that's really worrying, because either they do or they really don't, which is even more worrying. I'd rather them know and be hiding it, because then maybe at least they have an idea that it's not so bad. But if they absolutely have no idea, and the models are off and all the data's off, because obviously the numbers are off, they can't even test for this in China right now. They don't have the capacity, so all they're doing is the x-rays. They don't have the tests. The tests that they sent out, they were faulty. And a lot of those tests were going to China because they were running low. And then they arrived and the fucking tests don't work. So they can't test. So now they're just x-raying people. And that's what they said, well, that's a reason for a big jump in numbers. Well, yes, it would be. Because you're not having to wait, days for a test to come back. They're just basically, if you go in there and you have all the symptoms and you have a pneumonia, but basically they're going on chest x-rays. That's if you have the ammonia, fluid in your lungs, then and you got other onset symptoms like high fever and then yeah, they basically classify you as having it now, which it should have been like that way all along. But there was 2 months, and the numbers are 6,000 in 2 days, 6,000 cases in 2 days because of this new method. So yeah, and that's only the people that are actually diagnosed. That's not the actual people who have it. That's limited by their capacity and their quarantine measures. Like, everybody's terrified to say that they have this, or of course they would, unless they're really dire sick. But they can't go to the hospital anyways, even if they are dire sick, because there's no room. They built all these overflow hospitals, and they're all full. They're having a hell of a time trying to contain this, and they're just, in my opinion, it's just running around chasing their tail at this point. It's just not going anywhere, right? In China, at least. And the numbers that we're basing all our risk assessments off of is what China's reporting, with no oversight. There's different layers of reporting. Like, it goes from, like, obviously the doctor, and then the death certificates go to the funeral home or whoever, and then those get put into a system, and then from that system that goes to, up the tiers. There's too many places for this to be skewed. And China's firing all their officials, like all their, well, not all of them, but like the top officials in Hubei province where this happened, just to kind of show like a part of authority. Like, the highest ups knew this. Of course they did. The police wouldn't have arrested the doctors for no reason. They were talking on a WeChat. It's not like the local police are sitting there monitoring fucking chat forums over doctors, broadcasting a lecture. And, this was monitored and surveillanced from the highest up. Right? It was. And it was caught. And they went there almost immediately and tracked these people down and arrested them. That takes skill. Like, they were watching for this. Do you know what I mean? They would have had to have been, because they picked it up right away. The first time the doctor spoke out about it, Dr. Wei Lin Yang, the fellow, he's now dead because he caught it too. But anyway, it was a big cover up, right? And it would have had to been done at the highest levels, because the departmental levels wouldn't have that authority to do that, and they wouldn't have the fucking resources to do that. This was like a federal level, involvement. Like, they don't have a federal level in China, but the highest of levels. It's crazy, because they would have known. They would have, in order to catch that conversation and keep it quiet. And then now these other journalists are going missing that were reporting in the what was going on. They just disappeared. That's, the fucking red flags are everywhere. Really, they really are. And China's covering this up, and the half of it isn't even getting out. The stuff that even is getting out, it's not even the half of it. Like, all the videos that we see, like, with people dropping and stuff, like, and that's happening. That's actually happening. It really is. And they show up, they got hazmat suits on. It's not like people show up, from a medical emergency on the regular daily basis with hazmat suits on. No, they don't. They knew something was going on, and there was only very few videos that got out. But there was enough people videotaping this and uploading it that some of them did make it out. So, it wasn't just 1 or 3 or 4 or 5 of these incidents happening. It was thousands at the beginning. And then once they closed down Hubei, once they closed down our Wuhan, the first city, the 11 million, once they closed that city down, there was nothing else that came out of there. Because I was following that like mad. I really was. I was updating videos like to get the most current videos always being updated with like, you know, within seconds of each other. And then after the lockdown happened, it just stopped. It really did. It went dark. And there was very few new videos that came out. And the ones that I seen most of them. I did. I seen like most of the ones that are circulating around now. And there's not really anything new coming out of that area, really. It's all like, you know, other cities and stuff now. People are terrified to upload anything out of there because they're literally just killing people who are doing this. So nobody's taking the risk, and it's such a highly censored government. Like with their media and their internet, they rule the world in content moderation. They really do. Like they have the best software and equipment for detecting it like right away, right? If there's anything that's trending and it's against the government or anything like that, it's scrubbed. So, but yeah, there's big problems with, you know, and people are now questioning the World Health Organization. You know, experts are questioning the World Health Organization, saying, hey, like, we're seeing what's going on here. What the, you know, like, what the hell? Why aren't you guys on top of this? There should be some more action. Really. And what they're really upset about is because the Director General, he's of the World Health Organization, he's always praising China's efforts, like overly praising them. And he's like, well, you know, like one of the, for I think it was just before or just after he declared a state of emergency, and like it was almost for like 2 or 3 minutes. It was almost uncomfortable to watch that in a live broadcast, and I was just like, whoa, like, why is he going like, that's a little over the top? And it was just like, oh, you know, China's doing such a great job, great people, fabulous, we, you know, everybody should take an example from China. China's like, you know, leading the stage right now in this response, and like, just, I was just like, oh my god, that's disgusting. Like, why are you overpraising, you know? And then just kept going on, and even I was watching it going like, ew, that sounds weird, you know, like that's, maybe he's being genuine, but then it just kept going on, right? And it's Dr. Tedros, the other fellow Director General, and just, yeah, being overly appreciative, really. And what he basically said today in the interview as well is, are you, like, you know, are you taking any, is China giving any sway to make you, like, make them look good, or you know, kind of shadow the situation a little bit, so it's you know, it plays into their markets, or try to save their markets or something along those lines. Anyways, he didn't really say no, but he went into this big spiel. So anyway, now, you know, people are questioning the relationship because China is a very big contributor to the world health, and they need money right now. They do. They're broke. They asked for $675 million to fight this for 2 months. That was like their operational costs and their supply costs. So they're broke. The Bill and Melinda Gates Foundation donated like $100 million, and a couple other companies donated like $100 million, and I think Jeff Bezos got in there. But the fact is that they still don't have the money that they asked for. They don't. but China, I think, gave it to them. I don't know, maybe not, but a lot of people are kind of questioning this now, right? And you really have to think, like, would they, sway it just a little bit for a friend, or like for a big handsome sum of money, to kind of fight this thing because they don't have the money? So okay, yeah, we'll make it, we'll play into your hand, but give us the money, kind of thing, right? It could very well easily happen, and people are corruptible. The most trustworthy people in the world sometimes turn out to be the most fucking shady, and the most shady people usually turn out sometimes to be the most trustworthy people. It happens. It's an anomaly. But really, and especially at high up levels, right? Like the amount of influence going into these decisions, and it's huge. It's global, of course. You got the world's most powerful people with the most sway now probably having a say in this, or at least some influence, right? And everything is on the numbers. Everything. The World Health Organization, I'm pretty sure they know how bad it is, and I'm pretty sure the scientists know how bad it is. But of course, we're going on just what China's saying. And another good point that he made, I think it was Mike that made it, the assistant director. He said, if you're going to get, what did he say about, because he was stroking the ego of China, right, and saying, praising them, overpraising them, and he said, if you want to get your child to clean the room, you don't yell at them for not cleaning it for the past 2 weeks. And that's what he said. I wonder if I can find it. Let's just roll through it.
Again and again in credible international medical journals that continues to make international presentations. So I'm finding it hard to square that with Mr. Kudlow's comments. But everyone is entitled to their opinion, and everyone is entitled to suggest evidence for their opinion. And if there is any clear indication of what.
Here it is.
And we need to focus on training and behavior just as much as equipment.
Thank you very much. I know that we have Nina here in a room, but someone from AFP is online, so let's try to get that one.
Hello?
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 Hi, it's Dario Fudo from AFP.
Hi, Dario. Hi, Dario.
Dr. Ryan, you told us about the things that China's got right in the response to this virus. I was just wondering, do you think there have been any mistakes at any level in China in the response? And do you think there are lessons we can draw about future public health emergencies? Thank you.
Yeah, I think there will be lots of lessons. We're doing that right now in DR Congo. We just completed a peer-to-peer review of our performance there and the performance of other agencies. And the time for that is not now. But there isn't a single emergency that I've been involved with that we haven't learned something from, and China and the rest of the world will learn many lessons from this. Oh, at least we'll learn, and I hope implement the lessons of this. One of the tragedies of global response and public health response in general has been the fact that we don't tend to learn the lessons from response, or at least we don't tend to implement the lessons that we've learned. So no, but I won't go into, you lot have been telling us about all the things you think are wrong with the response, so maybe you should answer that question.
It's getting frustrated. It's getting frustrated.
No, I won't go into the details. It is not the time for us to start public recrimination. Everyone needs to focus on their performance now, and they need to focus on getting the job done. And the last thing you tell to someone that needs to get a job done is that you didn't do your job last week or the week before. That doesn't support performance. What supports performance is getting people to internalize how they can improve and get on and do it. So we will have that discussion and we will learn the lessons, and we are constantly in touch.
Okay, I got that wrong. It wasn't a kid cleaning his room, but somebody who didn't do a good job 2 weeks before. Yeah. But you know what I mean? That's true, you know, and they got to play nice with China right now. Because if China just decides for whatever reason to pull back and not let anybody in there, or if, like, you know, it's a very fine line to tread with the relationships with China. And I think they know that the numbers are off. Of course they do. But, you know, they're not going to come out and start, you know, overly criticizing China over it. Because if China gets their back up over this, you know, they could just say, get the fuck out. We'll deal with it on our own. That could be very bad for a lot of reasons. You know, China does, you know, if it could turn into a war. You know, it could. Because this virus could cause such havoc. It could cause, like, you know, countries to go to war. It really could. You know, so there's a lot of high stress tension, you know, from every angle from this, you know, especially financially more than anything at this point. It really is. It's not a financial, you know, or I shouldn't say that. It's in China, it's not a health problem. It's a financial problem, or it's a global stage problem. Do you know what I mean? Like, they're trying to downplay it and keep their stuff going, and now it's almost like everybody else is too. But we're getting real numbers out of these boats, or out of this one cruise ship, I should say, and it's a third of the people infected. And this guy here, let's just watch this video right quick. He's actually a part of the team of the World Health Organization, tactical team or technical team, I guess they're called. And anyways, let's listen to what he has to say, or if I can. Maybe that's not the right. Oh no, it's right here.
We met one of the global experts on modelling the spread of a virus.
We're probably where Wuhan was at the beginning of December in terms of the sort of numbers of infections which have likely established themselves in the country.
Do you think that the infection rate of 60% of the population, which has been suggested by some of your colleagues, is realistic for Britain?
Potentially. Given we know a lot about how these sort of viruses spread, we have lots of data from past epidemics, from influenza. Given how transmissible this virus appears to be, and the fact that at least all adults can be infected, we have much less data in children, then 60% is a reasonable figure for the epidemic size within the first 12 months or so. What we don't know at the moment is, of everybody infected, what proportion might die and what are the risk groups. Our best estimate at the moment is that maybe 1% of people who get infected might die.
And in a mortality rate of 1%, that's 400,000 people.
Potentially. I would emphasise that at the moment, you know.
And he's talking about just Britain, like just the yeah. He's not talking about the entire globe. Yeah, because Britain's got a pretty big problem right now too.
Putting numbers like 400,000 isn't necessarily helpful because we have so little information.
But it's not an absurd number.
It's not an absurd number. No.
Are we overreacting?
I would much prefer to be accused of overreacting than underreacting, let's put it that way. And this virus is the one which probably concerns me the most of everything I've worked on.
Yeah. All right. There's scientists that are claiming, like, you know, it's some batshit crazy stuff, and they don't understand it at all. And you know, we got a lot of people really mad in China, right? Because So let's check this out. A week into the lockdown, 50 million people in central China, the spread of the coronavirus is showing no signs of slowing down, and residents are beginning to vent their anger. So this is actually an older article. They're talking about Wuhan. So at the hospital in Wuhan, the epicenter of the outbreak, a man whose father-in-law had just died from the virus attacked a doctor, pulling and damaging the doctor's mask and protective clothing and potentially exposing him to virus, the state-run CCTV reported. And the man was detained by police. The incident highlights the growing frustration among citizens in Wuhan and across the province, where tens of millions of people are closed off from the rest of the country in Chinese government's radical effort to stem the spread of the new coronavirus. So far, that effort is not working. The Chinese Health Commission announced that the death toll from the coronavirus has reached 213, with 43 new deaths announced Friday, the worst 24-hour period since the crisis began. We've heard the worst 24-hour period like for the last 24 days since the crisis began. There are 9,810 confirmed cases globally, with more than 15,000 suspected cases alone in China. Hospitals, doctors, and officials in Hubei continue to appeal for more supplies and resources to deal with the crisis. Supply shortage led to some doctors in the city of 7 million people close to Wuhan to wear raincoats rather than protective suits and garbage bags as shoe covers, according to the Financial News. Imagine? That's how short they are, right? And it's terrible. This thing is ridiculously infectious. And unless you're wearing like real good PPE, like proper equipment and doing all the proper things, which probably aren't happening, it's going to wreak havoc on their frontline workers because they don't have people to replace them. They don't. So people trapped in Hubei are angry at the government's delayed reaction to the crisis, and that anger escalated on Thursday after the New England Medical Journal published a paper that revealed that human-to-human transmission of the virus occurred among close contacts since the middle of December. The government largely ignored the spread of the virus until the middle of January, and now Chinese citizens are outraged by what they see as Beijing's cover-up of the severity of the situation. I am no more than outraged and literally speechless, Wang, biology professor at the University of Zhang, wrote. This is the first solid proof that human transmission was intentionally hidden from the public. Wang's post was later deleted, the South China Sun Morning Post reported. Oh yeah, you can now go to jail in China for criticizing the government's response to the outbreak. Yeah, crazy, eh? Throughout the growing crisis, Beijing had tried to downplay the severity of the situation to silence those seeking to raise awareness of the new virus. In early January, police arrested 8 frontline doctors who tried to raise the alarm by sharing details in a private messaging group, though a court in Beijing this week slammed the detention, saying it might have been a fortunate thing if the public would have believed the rumor and then started to wear masks and carry out sanitization measures. And that was coming down from the highest courts in China, in Beijing. This was a judge. It wasn't the courts, I should say, but it was a judge who posted on a private messaging group. Anyways, it's even the courts were siding with the people on this, and the people heard that, they just blew up, right? So internationally, the virus continues to spread, with the UK confirming its first 2 cases on Friday morning. The US and Thailand authorities reported their first cases of human-to-human transmission of the coronavirus. The situation led to the World Health Organization declare an outbreak, public health emergency of international concern. So this one here is a little older. It is a little older, but it's still relevant. Now here, this is the main reason. Okay, yeah. So China reported 1,700 new cases in a single day. Yeah, it's going up, eh? And the numbers, you may as well just pretend that they're not even there. And these people on the cruise ship, like this is where the numbers are actually coming from, and I firmly believe there's more infected than well, not that reported, but are being currently tested. Because like it's very hard to test for this, and it takes time. They've only done 700 tests in like 12 days. Like, can you imagine? Like, it's vicious work. It really is. And that's why they let the other cruise ship go. There was another cruise ship in port there, and they said that they tested 1,700 crew members, and they all tested negative. But what's funny is well, it's not funny, but what's odd is, you know, that ship was in there for 4 days. They tested 1,700 people, and this ship has been here for like 12 or 13 days now, and they only tested 700 so far. So they just told that ship to keep going. They did. They told them to, well, not keep going, but they allowed them to disembark because they couldn't deal with another cruise ship. They can't even deal with this one. You know, so they just said, what the hell, you know, let them go. Like, it's here, like, what do you do? Because it would just be a media frenzy if the test came back positive. Right? Because then they would have to quarantine that ship and put all new resources there. They don't even have the resources now to support this one. They really don't. Hong Kong is sending people in to help. But yeah, this one here, on Valentine's Day, this woman gets confirmed for having it, and her and her, I guess, husband are on this cruise. Anyway, she gets confirmed. They come take her away on Valentine's Day. Fucking, can you imagine? You'd be just fucking devastated. And people, like, they're just, you know, you don't know. They're sitting ducks. They're just sitting there, and like, this thing is so fucking, oh, it's crazy vicious. And that whole ship is pretty well, you know, contaminated. I don't know if they'd ever get it out of the ship. You know, like, wow. Do you know oh my Jesus. Like, I know they do sanitation, I know they clean everything, but we don't know what this is yet. And obviously it can take over hospitals fairly easy. Which is unreal. Even people using the proper, you know, hospitals using, you know, they're pretty clean. You know, they're not infested areas. And then this thing's going through, you know, either the vents or passing through doctors or nurses, or, you know, some people think that, you know, it's futile to isolate every case of the virus, saying people with mild symptoms should recover at home. Well, yeah, you can't support every person that gets sick from this. You can't even support a 10th, 100th, 1,000th. You know, considering on a global scale, you couldn't. The health systems wouldn't be able to support it. But what we don't know is anything about it. It's so elusive. And they're saying, well, people have mild symptoms, but, you know, let's just think. If this thing got out on a timeline, let's just say, when did it break out? December 1st was kind of the first day that it was kind of recognized on paper. So let's say it was traveling for, you know, at least, okay, November. You know, November 1st. We'll go back to November 1st. Because it probably would have been traveling around before it got noticed. It would have had to have been. And we're just seeing mild cases here in the West, in the US and other places. People that are just catching it, just mild cases, you know, and like some people get, you know, hit by it pretty hard right away. But they're saying there's a lot of, you know, just mild symptoms. It takes, you know, this thing creeps for quite a while. It really does. You get this thing, and then like you get it, and then you don't have it, and then you get it, and then you can get better, but then you get sick again. And it's totally like just blowing their minds. They don't know what to think. The scientists are just like, wow, unreal. And it is still a complete mystery. And now there was 2 cases discovered in San Diego, and now they declare a local health emergency to aid coronavirus response. Well, they got 2 cases. Regardless of how you want to try to sugarcoat it, you just declared a local health emergency, right? And actually, it was 2. Yeah, I think there was I don't know how they did it, but I think there was 2 emergencies. Yeah, right over here. San Diego. San Diego declares 2 emergencies over coronavirus to free up resources. How do you declare 2 emergencies to free up resources? San Diego leaders declared a local emergency and public health emergency for 7 days over the novel coronavirus, giving officials access to resources to address the virus. Well, why do you have to have a state of emergency for officials to have access to information of a virus? I don't know. It's too much bureaucratic crap. It is. And the virus doesn't care about, our policies and politics and all this procedure. It doesn't. It's just going to keep fucking steaming right ahead. And I'm not trying to freak anybody out, but it's just a simple fact. They're not doing anything. The containment has failed in China. They couldn't contain it. It's just spreading even worse. They're throwing every resource they have over there. But now their front lines are going down. There's 1,700 medical staff who are infected with this. That's 1,700 staff at least. At least. There could be thousands. And who knows how valuable, well, they're all valuable people, of course, but how vital they are to, let's say, is he are some of these people senior experts, like doctors, like specialists, that would be a huge blow, if some of these people were specialists and they were infected, because, now you just have lost, an arm, really. In regards to, the people that you can have to diagnose this and understand it. But I think they have an understanding, but for whatever reason, they still don't know anything about it. Nothing. It's crazy. It really is. What's this? Yeah, when they say that they might need a coordinated economic response, they're talking about like the World Bank here, International Monetary Fund, and the global banks, like the central banks, like the top, like if they're engaging in this type of talk, that's huge, right? And all of this is huge, everything about it, except the facts. We see the response happening, at every level. We see the need, and even at the highest levels, that the World Bank and central banks are now involved. That's as high as it goes, right? So, but the news is like, no, just gonna take your temperature here. she's breathing at her nostrils. Like, if she is infected, or if she's not infected, she could, or she, do you know what I mean? If that just goes to show you the sloppiness, because most people just don't understand it, A lot of people still thinking, well, this is like SARS or MERS or whatever past outbreak that didn't really matter a whole lot. But this here's really different in every way. SARS was around for, how long was SARS around for? I think SARS was around for close to 14 or 15 months. And it infected 8,000 people, I think, and killed like 800. This thing's been around for 2 months. Infected, well, let's say countless, but officially 60-some thousand, close to 70 probably now. And it's killed almost, well, officially 16,000 and some. And it's only been 2 months. Yeah, this is not like SARS. This is not like the flu. And a lot of people are just trying to, like, flat out maybe just shun it off. And I get it. I do. Like, it's a lot to take in. Nobody really wants to think about that. But if you don't take the time, at least to prepare, it's going to be that much more of a shock when it happens. Egypt has confirmed Africa's first case, because Africa doesn't have a place to do this. The closest one is Egypt, obviously. So they sent the test there, and Africa's got it. So Africa's a very, very cultured, like, they're tribal people. They share everything. Everything's like a sacred thing, and that, it's very close-knit communities. This thing would just rip through there faster than you could imagine. And they don't have a front line for this. They really don't. Africa is dealing with, I think it's either Ebola or the measles outbreak right now currently as well. Which is very alarming, because if this thing somehow interacts, this new virus somehow interacts, let's say with Ebola or measles, yeah, right? Like, because it can happen. Like, two viruses can cause mutations, or we never know what happens, but it's probably not going to be the greatest thing, I don't think. And the chances of it happening are, who knows? But it could happen. Yeah, deep trade links. A lot of it's all like trade and economy and money at this point. So, which is also very important, because it's a catch-22 situation. If you lose your economy, well, shit's to bed. The whole world, everything stops. The transport, train, everything stops. So, but if you don't stop it, if you don't stop everything, the virus just keeps going and just keeps spreading. And we don't know the actual numbers. We really don't. The deaths? No. They're much, much higher, unfortunately. Because China would not go through the lengths they're going through for just the mild symptoms that most people are showing. They said they have like 2,000 and some severe cases. That can't be right. Like, no. You don't shut down your whole country, barricade in people, like, risk financial suicide on every level, right? Unless this thing, we don't know. We don't. As people, the fucking hand is over here doing something, but you're not watching what's going on over here. Okay, obviously it's a big problem, obviously, but it's obviously a bigger problem than what they're leading us on to believe. 143 more deaths. Let's see what that's all about. And there's one of the biggest cell phone expos. It really is. It's the biggest one in the world, and they canceled that as well. They wouldn't just cancel these unless there was a really good goddamn reason. Yeah, not good. And we know that they're full of shit. They have to be. If they're not full of shit, then they know something they're not telling us, right? And that's, I'd rather them know than not know nothing at all, because that's really bad. So, County Health Commission said it received reports of 2,641 new cases, and 143 deaths on Friday from 31 provincial level regions. So there's 31 provincial level regions, I guess, in China, because every province has this now. That's a lot of data to flow through different channels. China's not really the most forthcoming country, and they tried to hide the SARS outbreak too when it happened. They did, but they were able to contain it. And I still think that they might be trying to, believe that they can at this point, but I'm sure they know that things are happening pretty quick now. It's all shrouded in mystery for sure, and there's so many unknowns. And confirmed cases, yeah, it's just, you may as well not even look at the numbers, really. But let's say, okay, the cruise ship, let me think here, where was that? Where is cruise ships? I don't know, man. I got so much stuff here. But there's a third of the people infected on this cruise ship. And if we look at this from a scientific way, it's just not a third of the people affected. There's a lot more. And it's it's tough to do the tests when you don't have them, or when you got sent faulty tests, right? So let's see. All right, so this here is a breakdown of the RO value, the reproductive value, and this is the scientific breakdown of how they found out how contagious this is. So anyways, we'll just watch this right quick. It's not actually as long as it. It's only about 2 or 3 minutes, but it gives you a good rundown on how infectious this potentially is. And then this is the latest numbers for the RO
I've done
value.
this sort of modeling, but there's some pieces in here I think we can all sort of understand, which is important. They have some variables in here that you need to know about. L being the average latent period. That's the period that in between when you are being exposed and when you are actually out there being infective. There's a length of the average infectious period, so they're taking that into account. There's the logarithmic growth rate of the case counts as reported. So that's a given. That's an input variable. And so this is just how what the model was and how it was put together. But I think they've got all the big pieces in there. Looks good. So far, so good. All right. Okay. This is where we have to really strap ourselves down into our seats so we don't go flying off into outer space. Using the data described above, R is estimated to be 4.08, indicating that an infected patient infects more than 4 susceptible people during the outbreak. So this is huge. If this is true, this is absolutely enormous news. And it means that this thing is absolutely uncontainable. It means that what the WHO did yesterday, and by the way, this came out on the 29th, so the WHO has access to this sort of information, and they decided, you know what, we're not going to block travel, we're not going to block trade because, well, we would like the stock market to continue to go up, and we wouldn't want people to panic, or whatever their story is. But what they're really saying is we don't want people to be prepared for this. They've made some sort of a cost calculation and said, the benefit of letting people know about this versus the economic harm that would result from that versus not letting people know about this and just letting this thing sort of burn through and burn itself out, we're going to go with option B in this story. That's the only way I can interpret what they did at this point in time. So again, we've been using things like an R naught of 2.5. It's really even higher than a recent estimate of 3.6 in 4.0. So that's another study that they're citing here on citation 8. So this means that compared against the 2003 SARS epidemic, the R of this new coronavirus, novel coronavirus, is higher than that of SARS in the places where it was measured and used, calculated using the same method. So they did some sensitivity analyses. They varied the values of the latency and D. That means the resulting mean of R estimates is 4.08 with a standard deviation of 0.36. So it could be somewhere between those two numbers right there, 95% confident. That's what a CI confident interval, given these things. Now, again, this is early data. This could all change, but we're just giving you the best information that we've got. This is the best information I've come across. So what does that mean to have an R naught of 4.08? So I've cleaned up this table a little bit. You're going to see slightly different numbers because I thought of a better way to improve this to make it just a little bit easier to understand. So here we have a variety of R naughts down here that span from 1 to 4. And each one of those cycles, the cycle is when we start here with an R naught of 1, one person has it, and they give it to one other person, and they give it to one other person. With an R naught of 1.28, which is the average infectivity R naught of the standard or common seasonal flu virus, one person starts with it, and on average, they progress it to 1.28 other individuals, who, when we multiply that number by 1.28, they give it to 1.64. I'm now rounding numbers. But after 10 cycles of infectivity, the common average flu is up to infecting 9 people. And after 20 cycles, or hops from person to person, after 20 full cycles, 109 people have been infected by that original first person, with total infections, which would be the sum of this row, of 494. And obviously the total sum of 20 cycles through an R naught of 1 is just 20. So when we go to an R naught of 2, we can see that after just 10 cycles instead of 9, we now have 512 people have gone out and been infected. After 20 cycles, you have this crazy 500,000 number here, 524,288, with total infections of a little over 1 million. And SARS was thought to be around 3. It has this 3, which gives you these crazy numbers out here. But with an R naught of 4, what does that mean? It means that after just 10 cycles, we are at 262,144, which again, when CNN and the media is telling you that, oh, this is just like the regular flu, they are trying to convince you that it's comparable. To compare a value of 9 infected people out there to 262,000 infected people. And obviously by the time you get to 20 cycles through this, that's 274 billion. That's way more. It's only.
Yeah. So, and that is, we're getting, let's say a third of the people are infected on that boat. And this is, you know, okay, how many people did we have infected on the boat? I think there was 200. So we could even go for a medium of 3. Okay, let's just say the aeronaut's 3. The infected number of people on the boat is around 217. So let's just say that 200 and some odd people
only 7
can actually in turn infect 729 people. So of the 243 people that are currently infected on that cruise ship, they can, well, essentially infect 729. And 729 can infect 2,187. Because it's very contagious and that's under the right conditions, right? That's just not, you know, if all these people were, you know, kilometers away from each other or, you know, miles away from each other, you know, it might not, you know, they might not contract it, of course. But when they're in such a small area, and even before the lockdown of the quarantine ship, you know, this guy was on there and he got off the ship and went to the hospital and they tested him and he had it. So they were on this ship for 5 days with this person. And constantly it was being spread around. So it's probably a really high number on that cruise ship that are infected. And now there's all types of ranges of cases. They range from mild, you know, they're all mostly mild right now because they're just catching this thing. It's unreal. Okay, so let's go. I got another video that's kind of disturbing, and it's not disturbing to watch, but it's disturbing news. Where is it? Where is it?
On getting the job done.
Nope, that wasn't it. Oh yes. Okay, just give me 1 second here. I don't know, it might be where. Yeah, and here's the guy says, you know, all cruise ship members, more than 1,800 have been tested negative for coronavirus. That was on the last ship. That was in there. And apparently there was 8 infected people who were on this last ship. But anyways, what's really concerning here is they tested 1,800 people, and they all came back negative. But yet they've only done tests on 700 people, and that ship's been in port for 12 days. And this ship is, well, long since gone, but it was in port for 3 or 4 days, and they tested 1,800 people. Can you imagine? And this other one, they've only got, you know, they've been there for 12 days. And they only got... Yeah. All cruise ship crew members, more than 1,800 have tested negative. That's incredible, considering, you know, they've only... on this here cruise ship here, they've only tested to date 713 passengers, and they've been there since February 3rd. I call bullshit, and of course, for great reason though. They don't want to deal with that at another ship. They can't. It's not that they don't want to. They can't. They literally can't. It would break their healthcare system. It would. Okay, so this here question, and this came from the health minister in Ontario, Canada, who said that there's still virus in the negative samples that they're finding. The samples that are testing negative, they still have virus in them. And I don't think those viruses are dead. I think the virus is dormant. That's why you have symptoms, and then you don't. It's kind of like remission. Almost. Right? Like you get it, and then it goes away a little bit. But it's doing... I'll get into the reason why this is really particularly of interest.
Testing. Dr. Allen, I was wondering, this first couple that came back, what's the holdup if they're, like Dr. Yaffe said, they're not clinically ill anymore, they probably are fine. Why are the tests not showing them clear? Do they still have a viral load, or what's up with that?
Yeah, so there is some genetic material or viral material left in the individual specimens. We don't know what that means, whether that's...
We don't know what that means, but there's still viral load in the negative specimens. And this is from February 13th. Right, this is pretty recent. That is extremely worrying. Okay, let's just see what she's gonna say again.
Live or dead virus, but
wait,
I think
wait.
Genetic material.
Or they probably are fine. Why are the tests not showing them clear? Do they still have a viral load, or what's up with that?
Yeah, so there is some genetic material or viral material left in the individual specimens. We don't know what that means, whether that's live or dead virus, but I think the approach, and I'll defer to them, is we do know that there's some component of virus in those specimens, and the criteria that have been laid out are being followed, that we require 2 negative specimens until we understand more about what that means.
They have no clue, and I'm not laughing because it's funny. I'm laughing at the sheer incompetence. Because it's not incompetence because they're not smart enough to handle this. It's they're approaching it from a whole. They're all wrong. It really is. And now, what she just said there about there being some viral load still in the negative samples, and they don't know if it's live or dead. Well, I am not a biologist or anything of that matter, but this thing is extremely unknown, to say the least. But most people's cases, like here, new coronavirus found in Japan, evacuees who initially tested negative. Okay, and this, like, they had it, and then, or they didn't have it, I mean, sorry, and then, yeah, all of a sudden now they have it. There's been cases as well where people have it and then lose it and then get it again. And here's another case from a woman in Toronto in her 20s, and she tested negative at first and then tested positive. So the test results are all over the place. And not only that, to impede everything else on top of it, they sent out faulty test kits. And it's not they did, I don't... And who knows if that's just like a bullshit deferral or a deflection of some kind. Like, it's like, well, maybe they really didn't send out, or maybe they did, I don't know. But it's, regardless, that's a huge, huge blow to, like, the data coming in, which is already flawed at every angle. It really is. This guy tested. This was the first case. This was published in the New England Journal of Medicine, okay? And it was the first U.S. case. And he was showing, they tested him for everything at the hospital when he showed up, and everything it was negative for everything. And then they did, on the 20th, when was he admitted? On the 19th, he came in with a 4-day history of cough and subjective fever. Okay, this guy just had a cough and a fever. Other people are having like gastrointestinal, like diarrhea. Other people are having like it's all over the place. There's no rhyme or reason or consistency to this virus, which is like being symptomatic. But in the end, if it ends up in like pneumonia and multi-organ failure is how ultimately this thing takes over. But I very firmly believe that this thing is not something that came out of nature. It couldn't be. Like, it's baffling scientists everywhere. They have no idea what this is. But what I was getting at here is this fella here, he was testing negative, and he had in his blood. His blood was negative, but his nasal and oral tests were done, and on admission reported dry cough, two-day history of nausea and vomiting. Reported he had no shortness of breath or chest pain. Vital signs were normal within ranges on physical examination. Patient was found to have dry mucous membranes. Okay, that was on the second day. On day 2 through 5, a hospitalization, the patient's vital signs remained stable, apart from development of intermittent fevers. So he'd get a fever and it'd come back, it would go, and it would come back, which is really strange. Really is. You know, like, the patient continued to report a non-productive cough and appeared fatigued. On the afternoon of hospital day 2, the patient has loose bowel, reported abdominal discomfort, and they tested it, and his nasal and throat specimens later tested positive, whereas the blood still remained negative. This thing is super hard to detect. Unbelievably hard. This is the first case from the first U.S. patient. And then, so everything started to go south really quick. On illness day 7, hospital day 3, no evidence of abnormalities. However, on a second chest radiograph, they did show signs of ammonia. And then on day 6, day 6 in the hospital, he showed another, increasing pneumonia. And then they gave him, on day 8, patient's condition improved with supplemental oxygen, was discontinued, and he was breathing ambient air, blah, 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 blah. But people are getting better from this, is what I'm saying. But they're not showing up negative. They're not clear of the virus. Like they said it right in the video, right? That the viral load is still being in there, and they don't know why. They don't know what that means. They don't know if it's alive or if it's dead, but it's showing up in the test as negative. But yet there's still virus in the test. Yeah, right? It's like, what the hell? This thing is super like, it's I don't know. I don't even know the words, because the way that it's like, I don't know. I'm not a scientist and I don't know a whole lot, but just trying to get a little bit of understanding on the subject. It's behaving very, very erratically. Most viruses, like almost all viruses, don't do that. They have, they have a set symptoms. Like this is, you might have odd, fluctuations here and there, but this one here, every case is different. Everybody's got a little bit. Nobody's showing the same kind of things, and some people barely don't show symptoms at all. They're very mild cases, but they still have a high viral load, which is, I don't care, you know what I mean? The fact that the world is going through such a response, and especially China, really, it begs to question everything, especially with no answers coming from the World Health Organization, who are now being criticized, for their response, in a sense, and saying, hey, like you guys got some kind of thing going on with China that these are kind of just,
you're looking at the post-lunar year holiday.
Yes. It's funny, right? There's just funny things happening, strange things. And we can all see, like, the videos that come out of that place. They're constantly hauling, and these are older videos. They're just constantly hauling people out, and they're all in hazmat suits. And they're all masked up as best as they can, because you got to realize supplies at that time are low, but now they're completely out. And that's why we're seeing the numbers jump so high, because they can't do the tests anymore. They got sent faulty test kits, and at the same time, their healthcare system's so stressed anyway, but they're just doing the chest x-rays now. And if you're showing up pneumonia and you're looking pretty bad, they're basically classifying you as suspected. And if they pass away and they do a chest x-ray and you have ammonia, then you're classified as, confirmed. But the numbers are still very much off everywhere, really. Like, it's not a joke, and you can only look at science for so long, right? And then you just actually see what's happening. It's like that person went by twice. Deja vu. And these videos, you gotta realize, are older, before like the quarantine measures. I'm not sure what's going on here. Bunch of police, though. That's rough, eh? And they can't get taxis. The reason why he's carrying them like that is there's no taxis running. All the taxis stopped running because they wouldn't carry any passengers. It's just constant. I'm not sure what this guy's doing. I don't know if that stuff's gonna work. It might just look like they're doing something. And they're locking people in, like quarantining people in their houses for mandatory 14 days if they're infected, but they're not really thinking if a fire breaks out, right? What if a fire breaks out? Yeah, man, Isaac. Yeah, the Chinese government 100% are just trying to like protect their economy, right? But um you can only hide that stuff for so long. You know, you can't hide it forever because the world, no matter what you try to conceal, it's just going to keep spreading out, and it is spreading out, and it's overflowing. It is, and people just don't want to take the precautions. And some people just don't even want to acknowledge it. But out of 713 passengers tested so far, you know, there's 200 and I think 17 people confirmed. No, 218. Yeah, 218 now confirmed out of 713. So that's a third, right? And there's going to be more. You can guarantee it's more because the testing, it's flawed. The testing is flawed, and we know that now. And you got to take your own safety into your own hands, because these people aren't gonna. They're so bureaucratic, and they're so by the rules, right? Everything is like, in order for the next response to happen, certain criteria have to be met, and it doesn't matter what the situation is. If those criteria aren't met, they're not going to go to the, you know. So it's crazy. And now, like, the ways that this thing can transmit, you know, through your ocular surface, through the eyes, right? You can get this through the eyes. Because he was a specialist. He was, on January 22nd, a member of the National Expert Panel on Pneumonia reported that he was infected by the Wuhan coronavirus on the inspection in Wuhan. He wore his mask, but nothing to protect his eyes. Several days before onset pneumonia, Wang complained of redness of the eyes. Unprotected exposure of the eyes in the Wuhan clinic fever, you know, infected his body. Just through the eyes. So this thing is fucking vicious. You can guarantee it. Sorry about that. But that's not to freak anybody out, but that's, you know, it's real. And I'm not going to sugarcoat it. I don't give a shit. I hope I'm wrong. I do. But I really don't think I am. If anything, I think I'm understating how serious this is. Right? Fuck, you can only... It's crazy. It really is. So they're still waiting for results on 200 people on this cruise ship. And they have decided to let some people off, so that's pretty good. You know, like, they still have to go into quarantine. But it's fucked. I can see this just getting to a point where it just happened, just like China. Everybody's kind of just like, da-da-da, yeah, it's no fucking big deal. Next thing you know, fucking healthcares are overflowing and people are dropping dead in the streets. If it's happening there, it's going to happen elsewhere. Alright? You can guarantee it. If it's like that there, it's going to be like that elsewhere. Just a matter of time. Just a matter of time. Really, it is. And the numbers are so wrong. And when they talk about, like, nothing, because they know nothing. Look how many, like, this is a pretty big meeting. And there's only 1, 2, 3, 4, 5, and everybody's pretty far apart, eh? You notice that? Everybody's got their own space, which is recommended, but I really don't believe, you know, let's say this guy was infected. He very well pass it on to her, any of them. You know? Or... Really. But, like, that just goes to show you, you know, it's a health address, and there's, like, almost no reporters there, because coronavirus scare. You know, if they're taking these measures, right? What do they know that we don't know, or that the general public doesn't know? Of course they know. Goddamn right they do. The reporters. They hear the inside scoops, but they can't report on that shit. They can't. They will be locked up. Just like China. For inciting public fear or some bullshit, right? It would. Or inciting public panic. Well, we can guarantee you it would happen.
Yeah, so there is some genetic material or viral material left in the individual specimens.
Makes
we don't
no
know
sense.
what that means, whether that's live or dead virus.
We
but
don't
I think
know what
the
that
approach
means.
I'll defer to them is we do
Well, at
know
least
that
they're being
there's some
honest.
component of virus in those specimens, and the criteria that have been laid out are being followed, that we require 2 negative specimens.
So they're releasing people, even though that there is viral load still in there, right? They get 2 negative samples, okay, they're negative. But there's virus in those samples. Well, we're not sure what that means, she says. We've never seen that before. You know why? Because nature doesn't do this. That virus is dormant. I'm going to go out on a limb and just say that this thing is going into like a recession or like a remission, right? But it's mutating inside the body. And I think that's what we're seeing in China, is because they probably started out with very mild cases there, right? But then as you advance, right, there's more of a possibility that whatever this thing's doing in your body, it's fucking vicious. And we're just letting people like go. They let all those people, I don't know. It's just mistake after mistake after mistake, and you can guarantee that it's going to come out of nowhere, and most people won't even see it happening. It'll just be just like fucking China, and look what happened there, right? We're just making the same fucking mistakes. We are. The World Health Organization is waiting on data. Yes, okay, yes, they need data. That's important. But you know what I mean? They could know exactly the gravity, and they do know the gravity of the situation, but they're like, well, we just gotta wait on the numbers, right? Or on the data. With more experiments. More and more experiments. Like, or there's so many questions, right? And speculation, yeah, of course speculation. China is on fucking lockdown. All of it. All of it. All of China. Like, that's huge. I thought it was huge whenever they locked the first city down. And then when they decided that they were going to lock down like 16 other cities the next day, I was like, what the fuck? Like, the next day, these cities are not small. They got like tens of millions of people in them, each one. And they just like start rolling out the quarantine zone, and it just kept jumping and jumping and expanding. And now it's all the way down to Japan. Japan just fucking shut all their shit down. Everything. If you're not from there, you don't get in. Like, it's as real as it's ever gonna get. It went from one side of fucking China right to the other in less than 2 months. And yeah, look at the state that they're in. Right? And yeah, we don't see big numbers over here in the West yet. We're not seeing them. Because, well, most people probably don't know they have it. And they're just spreading it. Because it's, you can catch this and not show any symptoms. And just be spreading it all the time. And there's no way that they could track down everybody. And we're seeing like just mild cases so far, because when you first get this, that's what you get, is usually mild cases, unless you have underlying issues. Then it might attack you a little differently. But there's just so much misinformation even in the media. Like 1,800 people tested negative, but yet this cruise ship over here is only You know, they only tested 713 passengers since February 3rd. How? And it's the same port. Like, it was the exact same port as this ship's in. Same one. They let all they let all the people go. And it was confirmed there was 8 previous passengers who have this now. 8 people who were on the past voyage before these people got on. There was 8 people who got off the ship and tested positive. And you know why they said we did 1,800 tests. All cruise ship members, more than 1,800, have all tested negative. Wow, that's record fucking time, man. Like, why can't you guys, you know, test more than 700 people since February 3rd? 713 people since February 3rd. And that just came out today. Or actually, well, yesterday, I guess. Well, no, it's 2 days now. But regardless, you get it, right? It's not... The ship's been there for quite a while, and they only tested less than 1,000 people. The other ship was there for 4 days, and they managed to test 1,800 people. It's just incredible. So it's just obviously, you know, they're really trying to cover this up on every fucking angle, right? And I don't think the bottom people know as much. I think they're being fooled too, right? You know, I mean, I don't know. But the people at the high ups, you can bet that they know how serious it is, and they're trying to keep things rolling. Because right now, nothing's really outbreaking in the rest of the world. But give it time. Yeah, China. Yeah, the whole world and China. It's not just China, it's everybody on this. Isaac, yeah, man. For sure, dude. Everybody's in on this. Like, it's now a global effort, right? And you can't... It's like, you know, they said it best in the World Health Organization is one of the things that he did say that made sense. Is like, it's now a common enemy, right? It's a common enemy against humanity. And then people are like, well, no, it can't be that bad. Fucking humanity, Jesus Christ, it's only the flu. And that's what most people think. That's their... And it's being downplayed so much to keep things rolling, like you're saying. Like, you know what I mean? No, and the world's... You know, it's not affecting the world on a global stage right yet. Like as virus wide, it is affecting us on a global stage, financially and logistically, I guess, with every, you know, cutting down. There's everything comes out of China. Everything is made there. If you go and just look through your house and just pick up the bottom of something and see where it was made, 90% of it's probably made in China, right? So it's crazy, man. How it's going to affect the markets. The markets are going to go down, I think, before I guess the virus really takes hold. I'm kind of assuming, but unless they do like some kind of global action where, I mean, like, instead of just putting money on things, people just dedicate it to the cause, because if not, it's just all gonna go. But they're not at that point yet, because, you know, it's still like a, you know, and the World Health Organization is hanging on those numbers. Fuck, they're hanging on them. Everything they do, it's like, well, the numbers, and everybody says, like, well, you know, China's full of shit, and we know they are, and yeah, it's terrible. And this guy here says it pretty fucking good.
We met one of the global experts on modeling the spread of a virus.
We're probably where Wuhan was at the beginning of December. in terms of the sort of numbers of infections which have likely established themselves in the country.
Do you think that the infection rate of 60% of the population, which has been suggested by some of your colleagues, is realistic for Britain?
Potentially. Given we know a lot about how these sort of viruses spread, we have lots of data from past epidemics, from influenza. Given how transmissible this virus appears to be, and the fact that at least all adults can be infected, we have much less data in children, then 60% is a reasonable figure for the epidemic size within the first 12 months or so.
Within the first 12 months or so, 60% of the population. But it could be worse than that, because he's only going on data that's coming out of China, right? And all our data models are like what basically China says. I don't know, but it's she's fucking taking hold, boys and girls. And there's not gonna be like a news broadcast that comes out and says, hey, so shit just hit the fan. Good luck, everybody. They're not gonna come out and say that. Place would be burning down around us, and they'd be like, oh, it's alright. Here's Tom with the weather. You know what I mean? You can't panic the public. That's rule number 1 in any crisis. Don't create panic. Of course, you know. But people deserve the fucking truth as well. I'm sure, you know what I mean, like, people can fucking handle it as long, you know. But if you really if you hide it, you know, we've seen what happened in China when they hid it, right? Regardless, it still cost them time that we're not going to get back. The WHO praises of China's response have led critics to question the relationship between the two entities. The UN agency relied on funding and the cooperation of members to function, giving wealthy member states like China considerable influence. Perhaps one of the most overt examples of China's sway over the World Health Organization is its success in blocking Taiwan's access to the body. So, meaning, you know, China's been stopping Taiwan from getting on the board of the World Health Organization. Why? Anyways, a position that could have very real consequences for the Taiwanese people if the virus takes hold there. Right? So, for some reason, you know, China says, no, we've been blocking Taiwan, you know, to become a part of this World Health Organization. Why? It's funny. It's weird anyway. It's China. They do weird shit. So the World Health's position regarding China has also renewed a long-standing debate about whether the WHO, founded 72 years ago, is sufficiently independent to allow it to fulfill its purpose. You know what I mean? Like, it's funded by other countries, so, you know, you don't fucking bite the hand that feeds you, right? It would seem. China's Ministry of Foreign Affairs did not respond to question regarding Beijing's relationship with the World Health Organization. A spokeswoman or a spokesman for the World Health Organization directed CNN to comments made by Tedros this week when he praised China for making us safer. Yeah, I know there's a lot of pressure on World Health Organization when we appreciate what China's doing, but because of the pressure, we should not fail to tell the truth, the director said. We don't say anything to appease anyone. It's because it's the truth. Yeah, because he was going on praising China, like, just overly. And I kind of thought there was something off about that. I thought he was taking a poke at them, maybe. Being like, yeah, you fucking idiots, look what you did. Everybody should follow in your footsteps, you fucking dummies. That's kind of like what I thought he was taking, like, saying something like that, right? But I don't know. But anyways, the WHO was founded in 1948 under the auspices of still infant United Nations with a mandate to coordinate international health policy, particularly on infectious disease. Since then, it had many successes. But in its 7-decade history, the WHO has rarely been without its critics. They argue that it's overly bureaucratic, bizarrely structured, too dependent on a handful of major donors, and often hamstrung by political concerns. Following his election in 2017, Ethiopian politician Tedros became the latest World Health Organization Director General to promise large-scale reforms. So, yeah, and the first African to hold this position, Tedros took over following the WHO's self-acknowledged poor response to the 2013-16 Ebola pandemic in West Africa. The WHO took 5 months to declare a public health emergency of international concern over Ebola, a delay that undoubtedly contributed to unprecedented scale of outbreak, according to one academic assessment. In the failure, it was blamed in part on the WHO's cumbersome and complex bureaucracy. It is made up of 6 regional offices, which are only loosely controlled by headquarters in Geneva. Other factors blamed for the Ebola failure include an overstretched and underfunded surveillance team. Yeah, so they're, you know what I mean? Like, they depend on money too, right? Yeah. The WHO is both a technical agency and a policy-making body. The exclusive intrusion of political considerations in this technical work can damage its authority and credibility as a standard bearer for health. Yeah, it's fucking crazy. Taiwan's exclusion from the World Health Organization leaves its population vulnerable during this crisis. A lack of direct and timely channels to the WHO have already resulted in inaccurate reporting of cases in Taiwan. So, you know, we don't even know what's going on in Taiwan. It could be a shit show in there, right? But they don't have to report to the world. Well, nobody has to report to the World Health Organization, but they're not a part of it, you know. Similar concerns were raised during the 2003 SARS outbreak when Taiwanese scientists complained they were stonewalled by the WHO officials who told them to ask authorities in China for data about the disease. Because, you know, they're not a part of a, you know, that's funny. The issue has global ramifications. Cassim pointed out around 50 million foreign travels pass through Taiwan's largest airport every year. Yeah, we don't know, right? What's going on? Trapped in the middle. Just as Beijing's sway the United Nations means that Taiwan is likely never to regain its seat there, or regain its seat. Yeah, there's so much political shit that's going on in the background you couldn't even imagine. Yeah, it's if Tedros wants the World Health Organization to stay informed about what's happening in China and influence how the country handles the epidemic, he cannot afford to antagonize the notoriously touchy Chinese government, even though it is clear the country has been less than fully transparent about the outbreak's early stages and perhaps still is. Of course. Fucking right. They have to be. You don't shut down your whole country. You don't even shut down a city for a couple thousand deaths. You know, now they got the whole country shut down. There's something really off about that. And the fact that this whole thing is shadowed in this like fucking eternal shadow almost, because will we ever find out? who knows, right? Really. Who knows? Because they'll just probably let this roll right out until they can't contain it anymore. And then be like, well, due to all these issues and, you know, the faulty tests and, oh, we couldn't get our data, and they'll have an excuse. They will. And they can't predict for this stuff either, right? I'm sure they're doing, you know, as best as they can as well, but at the same time, you know, are they looking out for the public's best interest, or are they looking out for the financials' best interest? Because right now it sure seems like, you know that they're siding with that financial side of things as to, you know, because if they just keep things going as they're going, it's not going to stop spreading, obviously, and it's worse than what they're letting on. It really is. And the disease itself, you don't get rid of it. They're going to find, I think they're starting to find that out now. But they can't overcrowd the healthcare centers. As soon as somebody kind of gets better with this, they ship them out the door. Once they no longer need, I guess, inpatient care. It's just crazy, like, what the world's coming to right now. And it's gonna come, but it's gonna come down pretty quick. If it does, you know, if it gets to that point, the arse will just drop right out of her real quick. No, you don't shut down for thousands of deaths.
So as the coronavirus
Tens of thousands, hundreds of thousands, maybe.
The demand for face masks and sanitizers has shot up in India too. While surgical masks are already in short supply in China, Hong Kong and Thailand, India is also experiencing a spike in demand. All Food and Drug License Holders Foundation, that represents 7,000 pharmaceutical suppliers, has shared data. According to the foundation, the total market for masks has jumped from about 200 crore rupees annually to about 450 crore rupees over the last 2 months, with the demand shooting from 0.6 to 0.7 million masks to 1 to 1.2 million masks in a month.
Holy fuck.
Even though India's total population is close to 1.5 billion, it has a dismal capacity to make 0.3 to 0.4 million masks only. India has approximately 2.5 to 3 million in stock currently.
So
COVID-19 is the new...
So 0.2 to 0.3 masks. Million. So that's like 200,000 or 300,000. They can't even keep up with demand if they wanted to for masks. That's why they're telling people don't buy them, they don't work. Because the frontline staff don't have any. They're out. Like, not out, but like they're probably out in some places in China. But on the world, no. You know, like, oh, it's going to cause a lot of crinkles in the fabric of society. It really will. Aw, snap. Yeah, I don't know. But anyways, we'll go check through, what will I check through? Maybe something. See what the latest is or isn't. Which the news is being eerily silent on it. About the virus itself, right? Everything's kind of just deflecting off to like different anything to get people just like not really think about it, but about the virus itself, I mean, right? It's always about the deaths or you know, but it's nobody's really asking, hey, like, why the fuck don't you guys know what this is yet? You say it's either they're broad they got a broad range for it's either it's not that bad or it's completely shit show crazy. That's basically where they said that this lays in essence, from the World Health Organization. So who knows, right? But it's only a matter of time before we start seeing cases pop up more and more and more and more. And once you get a couple of hundred cases, that turns into a couple of 100,000 really fucking fast. If this is... Yeah, it does. Within weeks. It depends on the environment too, right? Like look at the cruise ship. Those people on there are done. If they didn't have it before, they probably have it now. All that circulating air. Yeah. And it takes forever to get tests on this now. They can't keep up with the tests. It's gonna break the front lines. Just with the overload, with the workload. It would be better if this thing was actually more deadly. It would. But it's not very deadly. Which is even worse because it makes it spread further. If a virus is really deadly, it'll kill itself off before it spreads too far. If it's just a little bit deadly or just enough, well, fuck, it can spread pretty far, right? Coronavirus. Yeah, there's a lot. There is a lot. But anyway, I think that's gonna do it for my little broadcast tonight. I just kind of basically wanted to go over, more than anything, everything, but at the same time, I want to dig into I'm going to dig into this a little bit more and find out why there is still remnants of virus in, excuse me, I'm like saying that really slow, still virus in the samples, but it's showing up negative. And they're letting people go. But they're saying, well, the virus is in there, but we're not sure if it's dead or alive. But it's showing up negative. Which makes no fucking sense. Right? I got a little bit of reading and stuff later on, so I'm going to do that.
Or they probably are fine. Why are the tests not showing them clear? Do they still have a viral load, or what's up with that?
Yeah, so there is some genetic material or viral material left in the individual specimens. We don't know what that means, whether that's live or dead virus, but I think the approach, and I'll defer to them, is we do know that there's some component of virus in those specimens, and the criteria that have been laid out are being followed, that we require 2 negative specimens until we understand more about what that means.
Does that tell you anything about the virus, or raise any questions about the virus, given that the London woman is now clear and kind of got sick like a day or 2 later than the first man? So what does that tell us?
Do you want to take that?
Well, I think, and everybody's going to weigh in on different things. As you know, the first case was a younger person, and the history from material from China is that younger people tend to have a much shorter course and throw it off much quicker in there. And as you remember, she was originally negative, but on the more sophisticated test, it did show slightly positive. So on a precautionary basis, she was declared positive. It may not have been live virus at that time, but so that she might have been clearing already very quickly because of her more robust immune system, etc.
They don't know.
The first cases were both over the age of older, and one had comorbidity, and one is our only hospitalized case in Canada, and had much more extensive pulmonary disease at that time. That's why the person was.
But she still has viral load, or still has virus in the sample, which is, I don't think the virus is dead. I think it's dormant, or in some kind of remission, and it comes. I don't know. I'm not a scientist, but it's doing some really crazy shit. and it's super hard to detect for. I don't know. We're gonna. I think. When's the? I'd say probably another week or two. Most places around around the world, because this thing takes a little while before it catches on. We're gonna see some numbers jump probably after this weekend and continue through the week in the rest of the world. So, anyways, I will keep you up to date as best as I can. Anything that's coming out new, I'm always trying to read up on the science of it as well, so at least, you know, there's a little bit of science to support my theories. But you know, it's not just science, it's common sense now. You don't need science as much as you just need to turn on, or well, not turn on the news, but you know, look at the level of response that is happening. And there's just a lot of shady stuff going on. Yeah, China lied to their people, so why, you know, like, they downplayed it. Why wouldn't the rest of the world try to downplay it too, right? But anyways, the rest of the world officially is waiting on data that we don't have, and we probably won't get anytime soon. So there's some links in the comments, you know, prepping guides and all that kind of stuff, because if it does go down, you don't want to be caught in that. You know, you don't. And it's not to freak anybody out, but you know, you want to be prepared before it happens, instead of trying to go out and prepare as it's happening. And who knows, it could just burn off, right? We hope, but for right now, it doesn't look like there's any end in sight. Hong Kong closed its borders. Like that's so. Do you know how far away like that is from where this started? Yeah, it's not. Yeah. See, they just 2,000 cases confirmed in 24 hours. Like it's just an absolute outbreak over in China, and it's gonna happen like that in the rest of the world too. Just give it time. You know, China didn't start out with a big outbreak. It started with one, maybe two or three. Who knows? You know, but it would have started with just very, you know, minimal, and it spread like wildfire. So you can only assume that it's going to do that in the rest of the world, right? No matter what the science and the scientists are fucking preaching and squawking about. Like, if it's happening there, you know, it's going to happen elsewhere, unless they can find a way to stop it. So, you know, you got to take your preps, or your position, and at least, you know, protect yourself, because you could have it and not even know it, right? Sniffles or little fever, cough, but we don't know anything about it, and they're just as much as in the dark as most of us, but they can't come out and cause people to start panicking, right? Because if people panic, they're going to lose control over it before they get a chance to stop it. Yeah, and here's some more cruise ships that were turned away, like in Vietnam. Like, I wouldn't want to deal with that either, but it's kind of a shady thing to do. But in Vietnam, they don't have a really, you know, big health, like, they're not really a big money-making place. So, you know, if one of these cruise ships happened to have infected people on it, they would have to deal with that. Nobody wants to deal with that, so they'll just keep pushing them away. But anyways, tomorrow's a new update from the World Health Organization. We'll go through that again. They're doing the daily updates now. Not that it really matters anything they're saying anyways, because they're just kind of circular conversations, and they're really good at that, right? They are. They haven't really given us any useful information except for the first technical briefing that they had. I think it was the day after they declared an emergency. and basically they told us a lot in there, and it hasn't changed, right? But anyway, now it's getting serious, and it's spreading like wildfire, and it's, you know, it's gonna be a busy week for some people. So anyways, protect yourself, stay safe, smoke some weed, chill out, don't think about it too much. You know, be aware of it, but don't let it rot you. You know what I mean? It's a hard thing to say, but at the same time, it's, you know, I think acceptance is probably a good thing to have at this point, and just, you know, being aware at least. And you know, some people won't be able to process it, of course. You know, nobody can be 100% prepared, for anything, but at least to have like a better heads up than what the fucking media is giving us, because those ass clowns, you know, they're just, well, I shouldn't say that, they are doing the right thing in essence. They are, because you can't panic the public in a situation like this. You can't, because it will just go to shit really fast. And yeah, everybody else sees that too, right? And then they see one person panic, and everybody else going to start panicking. Oh shit, George, look, Bob's panicking. Well, I'm panicking too. Fuck it. No, you can't prepare, but you know, it's you can a little bit. There are some descriptions or links in the description there you can check out. It's bare minimum, right? It's better than nothing. But I will keep you updated. I appreciate you guys sticking around and giving your info on that and commenting, because it is important to at least engage in the topic and explore what this thing is, right? Because it could be one of the most important things we ever do as a modern society. So with that being said, appreciate. Take care. Stay safe.